All right, this morning you are joining us for More Than Si Se Puede, Tackling the Mental Health Needs of Latinx Teens with Dr. Fairleigh Fabret. And we're going to go to the next slide and do a quick introduction, and then I'm going to turn it over to Dr. Fabret. So Dr. Fairleigh Fabret is the Director of Training and Staff Development for McLean's Child and Adolescent Division. McLean is the largest psychiatric affiliate of Harvard Medical School, and for the second year in a row has been ranked first in the nation for psychiatric care by US News and World Report. Dr. Fabret oversees and develops psychology training programs across the Child and Adolescent Division. She's the coordinator for the Child and Adolescent tracks of the McLean APA Psychology Internship and the director of their post-baccalaureate Child and Adolescent Clinical Fellowship, through which she provides supervision and mentorship to recent college graduates. Dr. Fabret is trained in cognitive behavioral therapy and dialectical behavioral therapy and has expertise in acceptance and commitment therapy. As a native of Mexico, Dr. Fabret has lived experience balancing the expectations placed by her culture and those imposed by her adopted country and culture. She strives to use her own acculturation story as a basis for understanding the stories and experiences of the trainees and patients with whom she works. Dr. Fabret believes that race, ethnicity, socioeconomic status, and the breadth of experiences of identity are vital elements when providing treatment, creating training programs, and when establishing supervision practices. This morning, we would very much like to welcome Dr. Fairleigh Fabret.
Thank you very, very much. I'm very excited to be here with all of you. I've been looking forward to this for months now, so it's finally here. So excited. And like Dana was saying, I have felt the pull and pull since I moved here, which was for college back decades ago in 2000. And it has inspired me to try to do the best I can for my community. But I'm not going to pretend I'm this expert on the Latinx culture. You should know this. We are all in this together, right? Like I learn every year, every time I come in contact with a teenager or a family, I learn more. So I don't consider myself as I know it all, like I'm an expert. I am more than anything committed. I'm committed to my culture, to my community, and I do the best I can to represent my community when I work with others, when I talk about the Latinx community, and also I'm committed to help others, especially those that are interested in learning, like how can we do better work with Latinos? I'm committed to put my knowledge, however limited it is, out there to make this happen and help us all, because we're all in this together. So if at any point you have ideas or thoughts, or like you're like, hey, I want to share this, please let me know. I am so happy to continue learning. And a lot of you work with teens, so it would be so lovely to hear some of your own experiences too. So please, it's open for discussion at any point. So, but why do we care? Exactly, Juanita. As a Latino, we keep evolving and growing. I love it. Okay, so why do we care? Like what's going on with Latinos in the US? So first of all, we are at this point about 62.5 million in the US. And there's a combination of people that are here for different reasons. So, obviously there's some Latinos that were here even before this was called the United States. So we have those. We have refugees that have run away from home. We have people that come here because they want to have a better life. And then we have, since 2000, the biggest percentage, that is the biggest group that's growing rapidly, is those that are native, that are getting born here in the US from Latino parents. So I have a little breakdown there. So Mexicans account for 64.9. I'm Mexican, but then we have like a good breakout for the rest. Well, I'm sure they're not all represented. This is what you find online. Census comes in the way, accessibility. So like, we don't really know the real numbers, but this is what it looks like right now. So it's a lot of us. And what's happening is So about 10 million of Latinos, which is like about 16%, they have a mental health disorder or issue. And less than half are seeking treatment, which is problematic. And this is where my passion kicks in, and my need to help, and my mission, because this is less than other groups. And for the 18 to 25-year-old group, less than half seek care. And that's our future, right? Like, so why compared to other ethnic groups, why are we as Latinos seeking for help in a less, in less percentage? Like, why are we so hesitant to ask for help? A lot of reasons. I'm going to touch on some that I think are important. So first of all, language. Now, a lot of agencies do not provide interpretive services. I am so glad to see that Caltrain has someone interpreting right now. That is so great, but this is not what you find in a lot of the hospitals. And sometimes when you do, and I don't know if you, especially, if you've ever worked with a Latino family, and for some reason the agency doesn't want you to be doing the translation as you do the English for the teen, let's say, and then the Spanish for the family, they bring an interpreter. And when you hear them interpreting, you sometimes are like, oh, no, that's not what I meant. Like, that's not what I wanted to say. And that's when you know what you're saying. So a lot of the times when it's someone that doesn't speak Spanish, that is using someone for translating services, the information that goes back and forth might not be completely accurate. It's also possible that the interpreter doesn't understand the cultural nuances. So this leads to miscommunication. Also, a lot of places, insurances don't provide reimbursement for interpretive work. So some people don't even want to use it, which is to the deficit of our patients. False fluency. This is what I mean by this is that sometimes we have doctors, a therapist, or, community workers that say like, oh yeah, I speak Spanish, I can talk to this family, but they don't really get the nuance. And sometimes the family ends up, or the patient ends up with the wrong diagnosis. Why? Because we're trying to tackle something that is not just language. It's about understanding where they're coming from. So they end up getting like, oh, they have ADHD, or they have like a conduct disorder, based on an assessment that they did when they really were not understanding the background. Obviously, accessibility is an issue. There's a lot, especially in my area, like in Boston, of Latino kids who need to see someone and they get referred by the school, but they don't have insurance. And that's a real problem. The parents can't afford their insurance, so they can't see it. And very few people do pro bono work at this point. So like, lack of access is a huge obstacle for engaging in services. Mistrust. I don't know if you've ever had a family member or a friend who is like, hey, I'm gonna get those pills in Mexico. I can get these pills without a prescription in Mexico. I'm gonna go do that. So a lot of our families either like call or like figure out how to get these alternative treatments from other places rather than go to the doctor here. Also, because there's stereotypes about American medicine. A lot of my friends and family have this idea that unless you're dying, really truly dying, American doctors won't look at you. And they're like, why am I going to go to the doctor? I don't even have this. So like, I'm just going to get the medication. I'm going to medicate myself through something that I can get with my family in Ecuador. So that's also another reason why they don't come to look for services. Fear, obviously, and in this, I'm going to say fear about the future, what's going to happen if I do reach out. Stigma is huge for our community, for a lot of other communities too. I don't want to just say that it's for the Latinx community, but fear is a huge factor. And also fear of deportation. Why would you bring attention to yourself if maybe you're not legally here yet? Okay. And another one that I think is going to make sense to a lot of you is that we tend to value personal resiliency. Oops, my watch is talking to me. Personal resiliency over vulnerability. And that's why I chose this name for this talk. because there's this push, like, you can do this. Don't show you're struggling. Keep your chin up and you just do it. And I'm not saying that this is not also common in other cultures. I'm just saying that it feels like home when I hear that, right? Like, it's like, you can figure this out. You don't have time to sit down and cry right now. So that's why I chose this, because the "sí se puede" phrase it almost defines my childhood. And I'm curious right now if anyone is willing to share in the chat. Have you heard this? Like, has anyone in your family said, like, "sí se puede"? And I want to know the context. Like, in what context was this given to you? Like, for example, me, I was really, really badly bullied in middle school, and I was really suffering. I was in Mexico. And my mother, I would come home crying, and my mother would be like, "Ay, tú puedes, Farley. Tú puedes hacer esto." And there was no discussion about my feelings. So I'm just wondering, have you heard this phrase from someone in your family or someone around you? And in what context maybe you've heard this before? We don't have to spend a lot of time in this. I'm just curious right now. I mean, this is something that we sing in football games, right? In sports, like, "sí se puede." When you're encouraging someone to do something hard. And I think it's super useful. Like, it got me through things. I think there's power to it. The issue, I think, oh yeah, Amy, I love that. Sí se puede, échale ganas. Mejorar la raza, it's all about mejorar la raza. Like, making things better for your kids. Like, you're trying to improve your family, right? As a group with your decisions. Of course, going back to school after I was a dropout. Yep. Oh, 4 children as a single mother. That's hard. Mom is a single mom. It was hard to raise me alone. I can't imagine 4. And I can totally see someone being like, "Sí se puede, Socorro. You can do this." Let's see. Yeah. Yes. We're never sick. You never miss school or work. I come to work dying because, I can never say I'm sick enough to not go to work. Yeah. Eso es fácil. Yes. Thank you so much for sharing. Yeah. So, what happens too is that we were brought up like this, some of us, and it worked. But right now, our kids are growing up in this culture. And this is just not going to land well with them. That's been my experience working with Latino families. Like, they can say all they want, "si se puede," and the kid is not going to feel good. That's not going to motivate them. They're not going to lift their chin up and be like, "yeah, si se puede, si se puede." That's not what's going to end up happening. So we need to change our tune. We need to use other strategies other than just buckle up and do this. So for that, the goal for all of us is, oh, Amy, you just said something that is so true. We're going to talk about this, like, not being curious about why we're struggling. Oh, we're going to get to that soon. So what we need to do to better address the needs of the Latino culture and the Latino patients is to provide culturally sensitive and affirming care. So now I want to make sure that you all know that I know that even between us Latinos, we all have different cultures, right? Like, some of the things I celebrate, some of the things I do, some of my beliefs are different from my Puerto Rican friend. One of my best friends is Puerto Rican. She thinks about things slightly different. Yes. And I have an Ecuadorian friend who does things differently, and their moms talk differently. So, like, I don't want to put this blanket statement and say, like, we all Latinos are the same. That's not my goal. I'm just trying to, like, put together some similarities between all of us to help us at least start with the baseline. Because after this baseline is curiosity, which is always important. And I'm not saying that Latinos are, like, oh, you all need to figure this out because Latinos are so hard. No. What I'm saying is that, as you can see from the stats that I mentioned, like, there are a lot of Latinos struggling and they need services, but they're not engaging in services. And when things are said and done and there's research conducted and all that fancy stuff, what comes out is that we're failing to engage Latinos in a sensitive way, in a way that feels applicable and respectful. So that's why I think we need to start from the bottom and say like, all right, how can I provide care in a way that a Latino kid or a family is going to feel supported by me, which is going to help me or open the door for me to help them learn how to be supportive to each other. So are you going to leave here and be like, oh, I'm totally, culturally competent? Never. You're never going to be culturally competent because you never get there. You have to continue to work on that, continue evolving. So that's why I like better to say, instead of culturally competency, I say culturally affirming, because you're like making sure that okay, so hold on, let me go to the next slide. So cultural humility, this is where we all are going to start today. Like, we need to understand where are patients coming from. And how do you do this? By being curious. You don't assume. Like I'm saying right now, I'm pulling a lot of things that are in common, that we all share in common in a way, but I would never advise you to go into a therapy session with a Salvadorian family and just pretend you can just use everything I'm telling you today without being curious. You can use it as a baseline. This is really important. But, you want to learn about your patient's values. Are they religious? What do they believe in? And then when you know all of this, when you have humility and you've taken the time to know, like, hey, I don't know everything. I learned from all of my families and I'm curious, then you can be culturally sensitive or affirming. Some people still call it competency, but like you can be responsive in a way where you start to take some of the things that you've learned from the family and you incorporate them into your interventions. I hope that makes sense. So you start to learn to adjust the way you work with a regular family by learning what they value, what they believe in, not being scared of what they believe in, but like using it as a way for them to feel understood and engaged in treatment. So for instance, a lot of therapists don't even bring up discrimination or feeling oppressed. A lot of therapists who work with Latino kids, it's like almost an afterthought to ask about like, hey, like, how are things going in the school? Is, in calling it, like putting it out there, like, I'm wondering because, you go to a very white school right now. Have you gotten any comments that have made me feel uncomfortable about the color of your skin? Now, you don't do that in the first session, right? You need to be curious and learn a little bit more about them to get to a point where there is, collaboration, and almost like you kind of get each other, because then they're not going to be offended when you ask. It's actually going to feel like, wow, yes, I feel like they see me and my family as like the poorest ones in the school, especially because I have financial aid. And then you can talk about that, but you cannot do a good formulation. You can't do really like a good treatment plan or really assess a family or a kid if you're not talking about this stuff. So it needs to come to the forefront. It can be an afterthought. So what do we know? Oh, by the way, I just want to tell you, this is like a little piece of information about me. When I was coming up with the slides for today, I was looking for pictures of Latino families on the web. And then I was like, Latinos hugging, parent and kid. Then I was like, why am I looking for pictures of Latino families on the web when I have my own? So a lot of the pictures you're going to see here are my family. So this is the first time I do it. I hope it's okay. But yeah, okay. So what do we know about engaging Latinos in treatment? First of all, there is a way in which there's like a formalism, even between Latinos. Some cultures do it more than others. Like, there's a lot of respect for elders. A lot of respect for elders. Like there's things you just don't say to your grandma that I feel like here is more accepted. So you have to assume and start thinking about the family in these terms. Like there's some formalism here, there's some hierarchy that you need to respect. There's ways of addressing each other that show this, like, it is kind of like a hierarchy. And it's very linked to respeto. Like you have to be respectful of each other. This is a big issue, obviously, with families when they feel like the teen is losing respect for them and their values and all of that, because respeto is so key, so important. Also, a lot of my colleagues that are from here, that were trained here, I was trained here in the US too, shy away from self-disclosure. Because in a lot of training schools and programs, they tell you that you shouldn't do this. But in my experience, and from what I know about our culture, that I'm going to say this word wrong, compañerismo, camaraderie, something like that. So this compañerismo,
Camaradería.
gracias, yes. This helps you do better work. So I do this self-disclosing therapy. Don't talk about like nothing that's too personal, right? Like no trauma, no medication, but like, hey, like I felt this. That makes you feel more human. That shows warmth, which is key. When Latino patients come in to see a therapist and the therapist is very busy, staying put, like staying in this like role of like doctor, which I'm going to touch on because I do think it's important for Latinos, but like if they're really cool, that's not going to go anywhere. It's not going to go well for retention. Latinos are going to end up leaving. Exactly, Alejandra, relational conversations. And that is that's where we use self-disclosure. So don't shy away from that. Just learn like why you're sharing. If you're sharing just to say like, hey, like I got it, like I'm there, good. But if there's any part of you that's sharing because you want them to have a reaction to what you're sharing, like, oh, you went through that, then don't share it, because then that's like that's another reason, and that's not as helpful. But it is a way of connecting. And then the other thing I was going to say is like, we use dichos, sayings all the time. And I don't agree with many of them, but they're part of the culture. So like if you start to feel comfortable understanding what these dichos mean, and then let's say a mom, right? Like I'm going to talk about one of these that makes me the most mad. But let's say a Latino mom is here and they're having issues with their daughter. And then, they're talking about how, they're so different. I would never do this to my own mother. Like I would get slapped in the face if I ever said anything like this. Like in that moment, I would say something like, wow, yeah, I get it. Like, calladita te ves más bonita, right? They're going to get that. Like there's some dichos that are so embedded in our culture. They're not good, but it's like a way to connect. It's like, yes, they always said that. And then they're like, yeah, and how is that problematic for you, mom? Like, in what ways did this get in the way of living your best life, or being your true self? Like, calladita te ves más bonita means, and this is usually used for women, is like, if you're quiet, you're going to look prettier if you're quiet. So they're taking away your voice, basically. But it was said to me growing up, anytime I had an issue, anytime I wanted to defend someone. So it just helps you connect with your families. And then I think it gives you a way in to then start to dismantle this, to try to break it away. Okay, how is this problematic for you? How would this be problematic for your kid that is growing up here? How is this in conflict with what she's hearing from school here? But then the most important thing here is that it helped you connect, and it's all about connection. Yes, so Alejandra, the chat, what she's saying, it's right on. So, like we are, by relating, by connecting, you're going to help the retention. Like I feel like sometimes Latinos do maybe seek out care and then they leave because they felt misunderstood. I'll share with you an example in a second. Okay, so the Latino, I would say that Latino culture is value-based. Like there's a lot of things that we really care about. And some of us really want our kids to care about, which is also becomes a source of conflict. But so some of these values are like personalismo, which goes back to what Alejandra was saying, like we relate. We're people relating to each other. We're warm, right? Like you want to use this in your sessions to connect and to keep them engaged. Simpatía, very similar. Like, yes, I think even sometimes we like get too far away in the dimension of like being like always happy, like nothing's bad, like it could be worse. So like, yes, you're gonna have to break through that to get to do real work later on in therapy, but it is part of something that we value. Like we value, in a sense, like showing up and being happy even when the world is falling apart. Like I said, formalismo, respeto, very important. Familism, families, and it depends, and we're gonna talk about acculturation in a little bit, but there's a lot of families that live for each other. Like they got each other's back. Even if there's conflict, even through the conflict, they're there to support each other. So sometimes in therapy, and I've seen it myself, and I've seen it through consultation, sometimes a therapist that doesn't understand the connection with family starts to suggest to a teenager or young adult, let's say, to start to detach, to become more independent, to let the mother know that this is not, and it's not that easy. It's not that easy. You need to really use your cultural frame and lens to be able to really help individuation in a way that feels respectful. We will go back to respect. Patriarchy, do I like this? No, I do not. And yet, the majority of our Latino cultures are patriarchy. The husband is the one that, calls the shots if there's a husband in the home. And a lot of women defer to them, their father, their older brother. And obviously, it can get in the way, but you need to be aware. Like all of those values that I'm mentioning are things that when you start to work with a family, this is in your mind and you start assessing to see if this is how they live their life. Do they value patriarchy? Or maybe you're dealing with a matriarchal home. My home, my family is very matriarchal. So, but that's different. I feel like there's a lot of my friends who are like the father's decision is the most important one, whatever they say. And also collectivism, which goes back to this, like we're a community, like we're in this together, like you want to help each other. Okay. This is my Dia de Muertos altar. I make it every year. I really care about that. That's one of my traditions that is like close to my heart, and I go all out and I do the ofrendas and all of that. That's a pan de muerto, which is also like, if you told me pan de muerto, like it takes me back home. So like, these are the things that if I was your patient, like, and you start engaging me this way, I would be like, yes, you got me. Yes. El Dia de Muertos is so important. Okay. Oh, socorro. I hope we're going to have time to talk about this more specifically. It gets me mad. So other considerations that we need to keep in mind when we're working with Latinos. So stigma, for sure. There's a stigma in saying you're struggling. There's stigma in saying you need help, because that's a different step. There's stigma in like really reaching for help. So if someone is already sitting in front of you, they're dealing with a lot of shame. You have to address this. Help your patient understand that you get it. Like, my God, you're here right now with me. Tell me what it took for you to make it in. How are you feeling? Like, does anyone know? How will you tell your family? Will you not tell your family? Like, shame is so directly related to anything mental health related for Latinos. So stigma is huge, and we need to talk about it. I have worked with families whom their kid is in treatment. So obviously the family is already like in the hospital, but the father refuses to believe that anything like anxiety exists, let's say. My kid cannot be anxious, anxiety, they're making it up. It's about this culture, all of this. And to be able to work with a kid that's anxious, unable to go to school, help the mom talk to the dad, because mom probably in this case was getting this more. Like there was support from the mom to the kid about the anxiety. You have to work with all of them in different levels and with a lot of respect and understanding so they can start to communicate. A lot of psychoeducation, but also addressing with the dad, like, my God, like it would be very shameful to like recognize that your kid is anxious, and just calling it out there, not in the first session. I'll say it again, like you need to have a relationship with them. Exactly, nervios. And we'll go into that too. Like I've talked to so much to some of my friends about how they say, like, I don't have anxiety. I'm just like really like jittery right now, you know, like this is going to happen. And I'm like, well, that's how anxiety works. And they're like, no, I'm just nervous. What is anxiety? And it's just so hard. It's so hard that, you know, I have some people too in therapy who have said, like, I have lower back pain. Like it really hurts. Like I feel so tense, like it's my back. I have a back issue. And I'm like, oh, what about anxiety? It could also be anxiety. So yes, like there's this reluctance to recognize that it's maybe because they think it's more serious, even though it's, to me, it's a synonym. They see it as more serious. Yeah. And sometimes it's one caregiver that is a little more resistant than the other. When they're both resistant, that's really hard for the kid, especially if they're there for the kid. But I often find that one of them is slightly more open to going into things than their partner. So I really want to help you all think, okay, so like recognize the importance. So as soon as you get a family in the door or a teenager, the best thing you can do for them and for their treatment is to create a good biopsychosocial cultural formulation. Some of us that went to school for mental health, like social workers and like psychologists, I don't know if psychiatrists are taught this, but no, I think they do. But like you're taught how to do like a biopsychosocial formulation. We need to think about the culture. So our formulation, when you're working with people from other cultures, not only Latinos, but here we're talking about Latinos, we need the cultural story too. Cultural formulation is going to help give you information about immigration history, about the home, family, the acculturation process, education. So let's talk about this in specific. And again, especially with the family, also with the kid might not know the answer to all of these questions. So sometimes you do need to check in with the parents, even if you're just seeing the kid for therapy. And getting the answers to these questions is going to be so important for you to have a better understanding of the family. So like you're working, if you go through this, you're working on your cultural humility. You're learning, you're being curious about where they're coming from. So immigration history, that's understanding who lives here in the US, who has already made it in, who is still back home. How did they come to the US? Did they cross the border, and like how scary was that, right? Like you can target that later in therapy, but like you need to get this information. Why did they leave? Why did they come to the US? Why is this important? Because you need to understand, like, did they come here involuntarily? Like, did they have to flee their country? Did their parents, let's say, like, were they here and then they just became part of the US? Is it that like long ago and they're still keeping their roots to Mexico, let's say? Did they come here to get a better life? And you want to really assess for intergenerational trauma, which happens with our community, right? Like some immigrants, they bring trauma from home because they were running away, maybe from something, from like insecurity, poverty, lack of resources, then they go through the process of coming here, which is pretty traumatic. And this obviously is going to impact the way they raise their kids. And sometimes the kids don't know the story because the parents don't want to tell the story to their kids of how they got to the US. But it impacts the advice you give, how you react to the level of freedom they want, if they start using or experimenting with substances, like all of this is impacted by their own story of immigration. So even if your immigrants, your parents, let's say, immigrated and they have this si se puede attitude, if you really take time to like dig deep, there's trauma there. And trauma impacts the way we relate to each other. So that's why assessing truly deeply immigration history is important. And if they've been here for many generations, that's another story, but that's so important to know as well. Then you also have like, who's in the home? So here where I live, there's a school where my girls go it's bicultural and bilingual. And we get a lot of kids midway through the year from other countries like Guatemala, Salvador, and some of them share that they cross the border on their own with someone who helped them, like a pollero, and because their parents were already here. So those kids arrive to school knowing zero English, and they're living in homes that have many families at the same time. So if you're working with a kid like this, if you're in a school, let's say, and this kid was referred to you, you're a social worker in the school, understanding who lives in the home is important because you're going to understand like what is going to be shared and what is not, because there's always someone that people are protecting in the home. And sometimes it's a person that doesn't have the documents, or maybe none of them have the documents to be here legally. But like this helps you understand like who is in the home, if there's an issue going on, like how is it communicated, and also are there secrets? What are the secrets? And it helps you build a picture, not necessarily that you're going to go into this in therapy, but this is just to make a solid understanding and formulation. Family connection is also very important. I don't know if you've ever seen families who even there's like a different kind of relationship between the firstborn and the secondborn. The secondborn has more freedom and the firstborn is angry. Like, why are you so lenient with my sister? Like when I was younger, is different. People evolve, right? Like we're always changing, but you want to understand like, how is the advice given? How are the parents feeling about, let's say, substance use? And what advice are they giving their kids? And how do the kids feel? And how can they talk to each other about this? Because they have to talk to each other. And talking to anyone outside of the family, including you, is shameful. So this is where you go back to tackling the stigma and being like, okay, you're here, you're ashamed to talk about this substance use issue, and you're also probably ashamed to be talking to me. So you start to normalize and create that connection with them in that moment. Then you also need to talk about the home culture, where they came from, how they see mental health, how they talk about mental health. And if they don't talk about mental health, what words do they use when they're struggling? And this is what someone in the chat was talking about. Natalia, she says, growing up, I was told not to talk about immigration status because there's fear, right? Like, what if I talk about, what if I catch attention? You're kind of told, depending on the generation you're taught how to be invisible. The more invisible you are, the better. And then sometimes this can lead to issues. Yes, Liliana, I'll get into that. Remind me if I don't. Okay, so what words are they using to describe what they're feeling? So, a lot of Latinos say, like I said before, like, my back is hurting a lot, like whatever. In my mind, I'm like, all right, there's some stress going on. Let's figure that out. Like, I wouldn't say like, oh, just okay, like this is medical. No. Like, take it into account. They're using different words. Cólera, they're blinding rage. That could be like an explosive episode. Maybe someone's gonna say like, I just, I had a moment of cólera, and like fighting with my parents, but like, you know, this happens sometimes and it's fine. Like there's nothing going on. Some people might say like, you know, I think someone gave me the evil eye, and I've been feeling like very paranoid that someone's following me, and I know someone it is. And if you don't understand the nuances, you might get like, what is this person schizophrenic? Like, no, you slow yourself down as a therapist. You take into account that we all use different words to talk about similar things, words that are more accepted by your culture. Maybe there's grief, right? And then you lost your cousin, and then maybe you feel like you see him and you share with your provider, and they're like, oh, they see ghosts, and you know, and they write you off. And it's like, no, it could be grief. And this is the way it's getting expressed. Like, why does it have to be medicalized? Like, this is where it's your responsibility as a provider to understand the cultural background and to be like, all right, what might be happening when they use these words? What might they be trying to express? And how can I help them feel understood? There's also, like with the dichos that I talked about before, there's indirect communication. Sometimes you don't want to come out and say it. Sometimes you just don't, because it's shameful. So you're going to find indirect ways to talk about how much you're struggling. Okay, religion. Even if you're not religious as a therapist, and this is where I feel like issues come into place. But like, even if you're not, you need to understand, how is religion playing a role in your patient's life? Is it an everyday thing? Is it a weekly thing? Is it a thing where just like for big decisions, it's like, do no wrong, like I don't want God to be angry at me? This is so important. And I feel like sometimes therapists who are not religious themselves, they forget about the importance of taking this into account, because they might end up giving advice maybe, or like, or guide them towards a place where it's just not going to be useful, because it's not taking into account a core part of their identity. So you have to assess this. And also racial trauma, like I said before, we have to start talking about this. The question here is reminding me of this question, like how do you increase comfort within the undocumented community in sharing this information? So if they're already in your vicinity, this undocumented community, if they're already in your vicinity, what I would do is to go there and say, like, listen, I know you're terrified to come and talk to me because you're undocumented. And I want you to know that, number one, my priority is to make you feel safe. So there's nothing you're going to tell me that is going to lead, well, unless they want to kill themselves. I work with a lot of suicidal teenagers. So like, if that's a different thing. And you can say that, like, unless you're going to kill yourself or you're thinking about killing someone else. Everything here is, and nobody needs to know your documentation status. Like, we are going to work together, and I'm going to help you out without this, without having to share this part of you. Now, the issue is bringing them in, right, into treatment because they're undocumented. So like, if you're at a church, or like if you're volunteering in a group and you know there's someone having a really hard time, but they don't have papers, but you know that there's a community center where they could be seen, you put it out there and talk about it with your heart, like with warmth, with respeto. And you say like, hey, I'm not sure. And maybe you don't even know that they're not documented, but I would say something like, I'm not sure what might be getting in the way of you getting help. Like, I see you struggling. I want to be able to help. And, you know, I work with other people before that don't have the papers to show that they're legally here. So I'm wondering if that's getting in the way. And if that's getting in the way, I want you to know that this is not going to be part of your records. Like, we have a system to make that happen. You can receive care without that. And maybe that's not it. So you give them an out so that they're not feeling this shame if they haven't told you that they're not documented. But I would put it out there as a different kind of option, because you have to assess this. We have to talk about racism. Because of this Si Se Puede mentality, learn to push these things down, and it just ends up impacting us. And by bringing it to the forefront, we give access to the patient and to us to address it directly and work towards healing. I can't say that enough. Okay, so talking about acculturation, when you're getting to know someone, to create a better formulation and understanding of your patient and family is key. The acculturation is a process that you go through when you're surrounded by other culture. Okay. Researchers keep coming up with different ways of understanding acculturation. I think that lately, like from when I went to school to now, there's been a more emphasis on the interaction between development and acculturation, which I really like, because the way the kid is developing and the different developmental needs is also going to be different in the way that it interacts with what they need from their environment, the way they make sense of their environment. New models also integrate the political context, which is huge. I mean, I was driving around my town, looking around, trying to see like who hates me now when Trump won. Like I was literally driving around being like, oh my God, who is going to hate me now? And I'm always ready for people to jump at me when I'm speaking Spanish with my kids. So you have to talk about this. And this is part of how we are always impacted by what's going on in the social and political context. And even with teenagers, there's something they know, and you just need to know what they know and how it's impacting them to make a good formulation. What I really love about the latest acculturation models is that instead of using this phrase like ni de aquí ni de allá, I used to say that to my friends in Mexico. I'm like, I'm not ni de aquí ni de allá, because I don't feel that I'm like my friends in Mexico. Like I've changed so much. And I also don't feel like I'm American friends here. I'm just not. I'm a new thing. Like my style, the cultures I value, what I'm trying to teach my kids is new. It's not the same as my mom is trying to teach me still. And it's not what other people are doing. It's like a new thing. So we use like acculturation is almost like a coping strategy that we use when we're in an unfamiliar situation, and we learn to thrive and we create a new model of existence. And it also creates stress in us when we're doing this, because we're pulled in different directions, right? So like, for example, I mean, how many of you were, okay, perfect example. Having your kids, if some of you have kids that are born in the US, and let's say you were Spanish speaking growing up because your parents didn't know English, let's say. Growing up, like raising kids here that are going to be very fluent in Spanish is a struggle for a lot of Latino families, because, you know, some of these kids refuse to talk to talk in Spanish. They feel more connected to their American friends. They play in English, they see English movies, all of this. And you are like, all right, like this is what it is. So maybe you talk to them in Spanish and they respond to you in English. But then your mother is mad because how dare you let your kids speak to you in Spanish? So this process of you getting used to different things, different pulls and pulls, is stressful, because your family from home, your family that's more traditional, is pulling you, being like, wait, what are you doing? You're becoming too American, but you're also trying to understand your kids and the fact that they have different needs. So all of this creates stress. And a lot of the times when you get a family in the door, there is acculturative stress that is the result of all of this push and pulls. And that's why you spend so much time trying to understand first, what are the factors that are getting in the way? What is complicating this presentation? What are the miscommunications in the family? And then, of course, there's all of this research suggesting that it's better for kids, Latino kids, to be bilingual and or bicultural. Not just linguistically, but like to have some of the traditions from their home culture, from the parents' culture, which is a tall order task, right? Like it's hard to keep up with a lot of the culture, the traditions that your own parents did, but there is research saying that it can be protective. So the more teenagers acculturate, the more you see substance use, dysregulated emotions, conflict in the home. So there's something to it when parents are trying to keep alive some of our traditions. So what do we do? What do we do? I was just reading some of the comments. Oh, thank you so much for sharing. I really appreciate this. So what do we do? How do we turn this into practice? So first of all, you're treating the family, again, respeto, warmth. If you get a sense that it's a very traditional family, addressing dad first. And also, as you work with them, you work to model giving the female the opportunity to talk as well. So not only to the dad, but you start to do all of this with curiosity and kindness and practicing what we've been talking about, which is like being culturally humble and working on making a really solid formulation, which is going to help you figure out what to do next. So with older generations, I think a lot of the work, honestly, is just help, like, first of all, like getting where they're coming from. And they're going to be maybe frustrated that they've been, in this country and things are so different and being, disappointed. But like we need to help our older generations come to terms with the fact that they're living in a new culture. We're here. And it's very important as part of the personalismo and the warmth that although Latinos usually, and maybe you'll disagree with me, but like we do like to defer to authority in some ways. Like the doctor told me to do this. We do that better with medical reasons because that's the majority of the reason why they would go to the doctor anyway than mental health issues. But like even though there's this tendency to tell me what to do, doctor. Come on, doctora, just tell me, like, what should I do? You say, no, let's work on this together. Like, I'm here to listen to you and I will give you feedback, but we're in this together. You need to help them collaborate with you and talk about how they are the experts. They're the ones that are living their life. They know the factors that impact every day, their day in and day out. So you basically create a collaboration, a warm relationship where you collaborate with each other and it goes back and forth and you acknowledge openly if there's a value that you just do not agree with. I'm going to share with you something that just came into my mind. So I've had the experience as a patient, I've had the experience where I was talking about something in the family and the doctor said to me, like, wow, if this had happened in my life, like I would have no relationship with my mother anymore. Like, how can you have a relationship with your mother after all of this? And I was floored. I was like, how dare she suggest the option of not having a member of my family in my family? And that was a huge rupture. Why? Because she gave the advice, not taking into account or being curious with me. And like, how do I see family relationships? Is it even an option to not be as close to my parents or my mother or my aunt or my cousin as I have been through thick and thin? Like, you stay in touch, but that's my value. But she didn't try to understand it. So I think like when there's different values coming up, you need to talk about that directly. Exactly. This happens with non-BIPOC. Exactly. Because, they're coming from another perspective. And let's say you're tempted to say that. Let's say I was tempted. I would say something like, wow, like I really want to understand more about how you see how family is, like, what's your relationship with your family members? Like, How do your family deal with conflict? Has anyone ever ruptured relationships in your family? To understand first. And then if I'm understanding like this is never going to happen, but I still feel strongly that she would benefit from breaking this relationship, I would say something like, wow, like I have a slightly different value when it comes to this. Like, I feel like your mental health is so important. You would do so much better if you didn't have this guilt around you all the time and your relationship with your mother was slightly different. And I understand this is a different value from yours, but I just wanted to tell you out of respect, because I want you to know what I'm thinking right now. And I know this is not what you're going to do, but I just wanted to be honest and come out and say this. And I think that's way better than providing guidance or assuming something that is going to be wrong, and you're going to rupture, and then the patient's going to disengage. They're going to be like, I am not understood. No, thank you. But we don't have enough BIPOC therapists, right? Like, that is a huge issue in our country. There's not enough of us out there. So that's why I love when non-BIPOC therapists go to workshops, try to learn, and try to practice being culturally humble. And also like figuring out like, how can we work together? Because if you do that, then we can start to treat more Latinos. But I'm jumping the gun. So, okay. Let's see. The other thing is like working with our older generations in saying like, yes, personal resiliency is so important. And you went through it, and the Si Se Puede worked, and you're here in this country. You've had 3 jobs. You've made it work. Your kid is in high school. Like, you've done so well. This is so well. And this can exist with vulnerability. It's not one or the other. You can say, I'm so sad. I'm gonna cry. I feel overwhelmed. I'm so ashamed. And after doing that processing, after giving yourself that permission to fall apart for, I mean, maybe they can only do an hour, but like fall apart for a day or 2, then pick yourself back up and say like, si se puede, I'm going to continue. They both can exist, but you help them come to terms with that it doesn't have to be one or the other, especially when they're trying to work with their kid who's is almost like encouraged to be vulnerable right now in this society right now, that where we're trying to make mental health less stigmatized, and we're trying to talk about our feelings and like it's okay to be not okay. We are basically raising kids to show vulnerability. So we need to get our older generations in with this new way of thinking. Like, yes, it's good to be resilient. It's so good. And a lot of people don't learn this, but it's also so important to be vulnerable, and you can do both at the same times. And when you're working with these older generations, you also want to be working with them with communication skills. And this is where it gets interesting, because you get to learn, because you're going to be curious and humble, right? You're going to get to learn about like, all right, how did your parents express happiness? How did your parents express sadness? How about anger? So you need a good baseline. How do they communicate emotions? Do they communicate emotions verbally or just by behaviors, right? And then you start showing them a new way. You say like, I work with parents that say like, I just don't want to express anger. Like, I don't want to be an angry person like my father. And it doesn't have to be that way, because there's other ways to express anger and deal with anger, and ways to channel anger that is not going to involve hitting the walls or hitting your siblings like your dad did hit your siblings, or like hitting another human. Like, there's other ways, but they need help communicating emotions just to begin with, and also opinions, but first and foremost emotions. Then they need examples on how to manage those emotions. So you can just be like, yeah, like, tell me you're angry, and let's talk about this. It's like, let's talk about how you're angry. Let's figure out where you feel your anger. Where in your body do you feel it? Is in your heart? Like, is your heart beating fast? Because if it is, what you can start doing is let's say like a breathing exercise, like the box breathing. I'm going to teach you how to do the box breathing. Or maybe, you have a slightly more like a dad that is a little bit athletic. And you said like, oh, I start to get angry and like my heart starts to race. That's a good moment to go for a run. Like you can do other things than hit or punch or scream. But we need to teach them and also model that. So like sometimes, and this is where the self-disclosure comes in, right? Like I'm very comfortable saying like, hey, I've gotten that angry before. I felt my heart doing this. And I used to think that breathing was BS. Like I used to think that breathing was such a waste of time until I started trying it. So let's try it together. Let's try it together because maybe you're like me. Maybe you're going to think it's BS, but we can figure this out. And if you don't like it, we'll try another one. And then you do it with them. Doing exercises with them or practicing how to talk to their kid when they get home is so important. Number one, they feel you're in it with them. Two, you're showing that you are collaborating. And three, you get to see how they do it and help them tweak it. And if it's a family therapy, like doing things in session, very important, but like also like do this when you have a good rapport, obviously. I would also say that part of engaging older generations is to make them, to let them know that it's okay to feel proud of their traditions. And it's okay to want to have those traditions at home. It's okay. Like this is part, like they've sacrificed so much to come. Like, why not? Yes, do it. Do those traditions. And I'm going to help you with your kid so they can also participate in this. Because this is not all about your kid. We're working in this together. We're all in this together. So we're going to figure out how and what works. But yes, be proud. Be proud of your traditions. Bring them on the table. Help your family care about these things that you care. Teach them why this is important. Teach them how you started to care about these traditions. Don't just impose them, which is already a skill that a lot of our parents don't have, right? Like sometimes the thing is like, you have to do this because I said so. So if you're already teaching the parents like, hey, we're going to celebrate Dia de los Muertos this year. And your teenager is like, oh, what? Like we've never done this before. Having the parents sit there and be like, this is why it's important. This is how it started in my family. This is the people that I want to put in pictures. And this is why, this is the relationship I had with them. That's going to be much more powerful for the kid. And it's not going to feel like an imposition. It's going to feel like an activity together. But you're also going to be working on the side, or someone else, another therapist on the side with the kid, helping them also create an appreciation for this, which is important for them and also for the family. And of course, empathy. Now, with the younger generation, very similar, right? Like they come into seeing you and they're like, I hate my parents. They're awful. They don't get me. They're so conservative. Yes. And you're going to connect with that. And you're going to be like, yes, I get it. Let's talk about how you feel. How does it feel in your body when they start telling you things that you disagree with, or when they tell you that being gay is bad, when they're trying to tell your own children that they're going to go to hell if they marry someone of their same sex, because it happens in our families. Like, how do you deal with that? Like, where do you feel the anger? Where do you feel the sadness? And then you teach them skills. Like, how are you going to tolerate this so that you're better able to have a conversation with your parents and they understand where you're coming from instead of ending up in a blowout? You teach them to understand their own experience, but also their parents. And this is where sometimes, I mean, a lot of teenagers don't want to validate their parents and they're like, they're wrong, I don't care what they think. But it's important. It's important. It's a family and they have a point. And what's getting in the way is the anger, is the words that are being used, and is a lack of space to understand. And that's key to working with any families, but especially our Latino parents and kids. So you work with the kids to, how can you describe this experience? Mentalizing, what I mean by this is being able to understand someone else's perspective, like getting in their shoes. This takes practice. And sometimes, maybe I create a scenario and I say, how do you think I would be feeling in that moment? A lot of teenagers, depending on their age, like this is just not a skill that they've developed, but we can help them. Of course we can help them. And then cultural pride. This would be complicated if they're ashamed of their culture, which of course some teenagers might be. I would want to explore why. I bet that would be related to some sort of discrimination, experience with discrimination that they had. Like I would explore that. But if that's not the case, I would talk about like why it's important to care about your culture for connection with your parents. And then I would say like, listen, having a group where you feel like you belong and you're connected is going to be so helpful for you in the future. It's going to be protective. Maybe you don't get it now, but for now, it's going to help your relationship with your parents. If you feel more connected to your parents, they're going to be more willing to give you some of the freedoms you want. You figure out a way to like loop it around so that it ends up working for the teenager. But like, I do think that trying to get our teenagers to feel pride in their culture ends up being protective if we explain it the right way. Because I can totally see some teenagers being like, F you don't get this either. But I would definitely try that. So I want to talk about 2 skills that I think are key and very hard for Latinos. And I'm curious if you find this in your practice or when you talk to Latino parents. One is validation. Validation is listening with curiosity, not trying to change things, not judging, understanding the other person's perspective. I'm going to give you an example that happens a lot, and I've done as a mom. But let's say your kid comes from school crying, saying like, go back to school tomorrow. I'm going to go back to school tomorrow. I hate school, blah, blah, blah. And you say, what happened? And they're like, no, I go back to school. The teacher doesn't like me. I raised my hand and I shared my answer. And the teacher kind of like laughed a little and like, no, Tommy, that's not it. And they don't like me. And that's it. I would bet that the highest percent of moms or dads in this situation would say something like, Tommy, they probably were laughing about something else. You always think it's about you. You're going to go back to school tomorrow. Go do your homework. Or you have a kid come in, teenager, and they're crying and you're like, what happened? And you're like, I'm never going to have friends anymore. Everybody hates me. And, I don't even want to go back to school tomorrow. Everybody hates me. And you're like, what happened? And they say like, well, these kids sent this text message to me, my friend. And, everybody, like, I'm not going to have friends anymore. Like, just, that's it. Like, everybody hates me. And you say, well, I'm sure that's not true. The neighbor right here loves you. And you're going to go back to school tomorrow. These are just things that happens with teenagers. Teenage girls can be so mean. Like, you're going to be fine. You have friends. Don't forget about that. And you're going to go to school tomorrow. A lot of the times, for some people, this works. Okay. This is kind of like a si se puede mentality. This works. Growing up, I got this. And I was like, okay, I'm going to go to school tomorrow. Yeah, okay. And I went to school the next day. Now I recognize the importance that having a moment to talk about how it feels, like the importance that it has, just to have that moment. And Latino families here, because of how the messages we're giving to our younger generations and like the vulnerability that we're encouraging, our teenagers need that space. They need the space to talk about how they're feeling. So a lot of the work, let me see what I'm saying in the next one. Okay, I'll go into that. So a lot of the work is creating that space. And it's reciprocal. So for example, in that moment, you know, like for the mom or the dad, when they hear like the kids say, like, I don't want to go back to school tomorrow, there's fear in the mom, like, oh my God, like, what am I gonna do? If they don't want to go to school tomorrow, like, I need to go to work, they can stay home, I don't have a babysitter, I don't have the money for a babysitter, like, and that's fear. And fear makes us respond like, you're going to school tomorrow, I don't want to hear it, you're going to, that's a response to our own fear. So having the space for the parent also to talk about how they're feeling in that moment is so crucial. So the way this would work. So, okay, so validation. What do you validate? You validate feelings, you validate thoughts and behaviors. And you do it when you're talking about something. It doesn't matter what, something that's stressing. It's very important to me that you understand that validation is not that you agree. Okay. So sometimes when you don't agree with the behavior that they ended up doing, you validate the feeling. You can say like, so for example, in the example of this girl that got the text message and she started to say like, I don't want to go to school tomorrow, nobody loves me. If you slow yourself down as a parent and in that moment, you say something like, wow, you look so stressed out right now. Like, tell me more about what's happening. What else happened? What did they say? And then you say like, wow, like I would have felt so sad if I got the text message. How do you feel? This is where the self-disclosure, even with friends or family, is so important. It just makes it more relatable. And then maybe the kid says like, yeah, I felt super sad. I felt ashamed. Like, why do they want me? Like they didn't send this text message to other friends. And then you ask more questions, right? Like you're being curious, you're listening, you ask questions. How do I validate? You reflect back what you hear. You say things like, wow, it sounds like it really hurts you. Like you feel like your heart is a little broken right now because of the way your friend treated you. You summarize and all of this. You can do all of this and you don't have to agree with their statement that they're not loved and that they're not going to have friends. And you don't have to agree that they're not going to go back to school the next day. You're just validating the feeling. You can even say like, wow, like I would think the same way. I think if this happened to me back when I was younger, I would have thought the same way. And I get why you're so sad. And I'm sorry. I'm sorry. This is so hard. And maybe this is where you give a hug. So when you're working with parents, this is exactly the modeling that you do. If the kid is not in the room, you pretend like they're in the room and then you do this. And then you pretend to be the kid and come up with the situation to see how they would do it. And maybe you have these rules written down there so that they remember, because it's not intuitive. Validation is not intuitive for our culture, in my opinion, because we're like grinders, right? Like you want to get going. You don't want to waste time feeling sorry for yourself. It's not sorry for yourself. You're sad. Sadness needs space. If you don't let sadness be, then other issues come up later. We've seen that time and again, substance use, eating disorders, like it's feelings that were not processed. So I practice this with kids too, for parents. So it's like, wait, okay, so why do you think your mom reacts this way at this moment? Like, what might they be thinking? What might they be feeling? Are they scared? Are they worried about what's going to happen to you? And when you get there, you say like, all right, let's do this. Let's figure out how you can validate your parents and help the teenager understand that this doesn't mean that they're agreeing with the parent. It's just like, Mom, I know you're really mad at me that I did this. Like, I get it. Like, let's talk about, or maybe not let's talk about how you feel, because I don't think the teenager would do that. But like, I understand that I made you really mad. Like I've disappointed you. And then you just like pause and continue the conversation. So validation in our culture in this age has to happen. It has to be. When parents say like, I don't need to stop and tell my kid like, like, good job for doing the chores. That must have been hard. It's like, yeah, like, yes, you have to. Why? Because it feels nice. It's like, hey, Fairly, I know you really didn't want to dust the furniture today. You hate it. Like that's a chore that you hate the most. And I know you really didn't want to do it. And I just want to say thank you for doing that. I've been so tired at work. Thank you for doing that. And that's it. You don't have to say more. Exactly. Praise the good behavior. And yes, no validation growing up. And it's hard. Like I'll tell you, me personally, I mean, not anymore, but I had to get myself to learn how to validate so that I could do it to my kids because I didn't grow up like that. And I know it's important. It makes the other person feel heard and cared for. How is that wrong? How is that wrong? So, so then a lot of parents are like, I'm not going to do this to my kid. Like they should be doing this. And like, yes, and yes, they should be doing this because we're part of a community, right? Like our home is a community and we all are responsible of different things. And it's also hard. So why is it wrong to say like, hey, thank you. I know you didn't want to do that. Thank you for doing that. Thank you for coming with me to drop this off. Like it's just part of showing, I guess, vulnerability in a way. But it is very important. The other thing I see is acceptance. A lot of parents get really worried with accepting things as they are because we catastrophize. It's like, I can't accept that this is happening. Like my kid is doing poorly in school. What does this mean? Are they going to be a dropout? Are they going to get another? And then the push creates this huge gap between them and the kid. Acceptance doesn't mean that you agree. It doesn't mean that you want this to continue forever. Acceptance is saying like, okay, I got you. I see where you are. And after you accept, after that push and pull stops because you're like, okay, I'm here. This is what I'm dealing with. My kid has learning disabilities, or like my kid has been using marijuana and this is what it is. And they want to continue doing this. And okay. Me saying don't do it is going nowhere. So what am I going to do differently? But this is where we are right now. That is really hard. And I'm not going to sit here and say that I'm the master of acceptance because I'm not. I am not. It's really hard. And I think it's so important because I feel like acceptance is basically like letting go of the struggle. It's like, those like, I think they call it the Chinese traps. I think that's what they call, like when you put the fingers in and you're trying to struggle and you can't pull it out. And the more you struggle, the worse it gets. Or like being in those like arena movediza, I forget the name, the arena movediza, and that you're like trying to get out and you can't. Acceptance is you stop doing that. You're like, all right, I'm here. What are my assets? What can I do? Quicksand, thank you. Yes, letting go of control. And then after that, I feel like you can start to see things differently. Then you can be like, all right, this is where we are. What can we do? And that is so hard. Okay. So we have a case example. Let's see. Who is my person here? Haley. Oh, there you go. Okay. So what we're going to do is that we're going to get in small groups and you're going to read through this vignette. And then there's some questions there. And when you're looking at those questions, I want you to think about all the things we talked about. How to approach a family. What should you know about the family before you even start to like, oh, I see what's going on. No. We need to understand them better. Cultural humility, so that then we can be more affirming. So we're going to spend 20 minutes in this, maybe less, but we're going to try and make it 20 minutes. And with your partners there, try to answer those questions that I asked. And then when we get back together, I'm going to ask, some of you to share if you're willing to share, and then we'll open it to questions and answers. So I'm very curious. We're going to discuss this a little bit. And then there's one more thing I want to address, and then we'll open it up to questions and answers. But I'm curious to see, for those of you that have done assessments before, or like a formulation, getting to know someone in intake, and also those of you that have not, what questions did you come up with that maybe you hadn't really thought about before, that can help you write a good biopsychosocial cultural formulation?
Yeah, Carly, can I share? Hi, I found myself struggling asking questions or finding questions because my initial interaction with the Latina or BIPOC community is not straight to what is the biopsychosocial. It is about connecting, and then the information just flows out of there and questions flow out of it. So I was like, wait, so I need to find out about the medical, like my mind was going and like, I need to find out the medical, like what is the psychological, what is going on? And then, so there is such a struggle to go straight into these structured questions because it is not about asking them. It is, I mean, they will come as we're connecting.
Yeah.
So,
no, I completely agree, Alejandra. So like, this is, some people do their initial evaluations in a session. I would say like, I take my time, right? Like you don't do it because like we've said, relationships and connecting are key. And in doing that, you show your attention, intention, you show your warmth, but like there's things that sometimes people don't even ask and they're important. So for example, like were your parents born here? Like, are your grandparents still here? Are they here? Are they legally here? Like those things that we don't think about sometimes. And they're just so important to understand subtleties that maybe you wouldn't know if you don't ask directly. But yes, I agree. Like I wouldn't sit there with a patient the first time being like, what about this? What about that? What about that? What about that? Because I'm going to lose them. Yeah. Philip, you're unmuted. Did you want to say something?
I actually do, yes. So my group was really great. And they came up with a lot of things about like what kind of supports, do you feel, disenfranchised, tell me more about your situation. I would assume that he was not actually born here because it looked like 15 years and he's 16. So, but the biggest thing that stuck out to me, and I agree with Alejandra about establishing a relationship, is once I've kind of established a relationship, that kid can't really leave my office until we talk about suicidality.
Oh, yes.
That part comes out of me like I was, my psychotherapy hat. I had to like take my cultural hat and just throw it out the window because I'm like, man, I don't know what this is. When this kid leaves here, does he have a means? Is he going to swallow a lot of pills?
Yeah.
Does he, does a gun? Does he have one? How could he do it? So all of those things like that, you're saying, what's the first thing? The first thing, yes, establish relationship. Once I've got some kind of footing there, I got to ask about those questions, and I can do it very gently. It doesn't have to, are you going to kill yourself? Tell me, please, tell me more. Motivational interviewing to me is invaluable. So tell me more about that. So that's just me.
Yeah, I love that. And that is a very good point, like especially with the history that Jesus is coming with, like you have to address that in the first session. I mean, you're just going to be one of those things that you continue to ask about their suicidal intent.
In my group, we also Jason and Edgar was in my group, and that's one of the things that also came out. Jason was clear about making sure that these ideations had subside.
Exactly.
Yeah, and going back to the question that you first asked, I will gather more information about the belief system of the parents, because they come from different culture backgrounds, and that can influence the kids.
Exactly. So as you were talking about parents, would you and I know we don't have much, like this is a brief snapshot, but like, would you want the parents involved? And how would you involve them?
What we came out with is that we will ask the kid himself and see if he would want the parents to come in or not. Not in the very first session, we would build a rapport first.
Yeah.
To have the kid. If by any reason the kid says no, then we would, give them some example why it would be beneficial. We would try to, maybe do some mock sessions, how might it come out? Or then we would just tell the kid that we're going to meet with the parent alone to talk about some parenting.
Yeah. Yeah, because sometimes, you know, you start working with the teenager, start giving advice. They put it in place and it's going nowhere because, of course, the parents are not there. They're just not speaking the same language, like talking about feelings and other things. So like, this is when you say like, oh, like this is one of the reasons why it would be so nice to have your parents come in and talk to us.
Hi, hello. In our group, we kind of spent a little bit more time on kind of what we go through in our cultures, which are I'm Hispanic and my other another person in there was Black. So we talked about the similarities of those two cultures when it comes to medical attention or mental health.
Yeah.
But I think it's great for the person, the individual that we get as a trauma-informed care type of aspect, is that we find out what interests them in regards to what social organizations are they already, because they sometimes when people have issues with their family or their friends, or their parents, they can seek support other places and be just as okay as by not receiving their parents' support anymore, by being, with social organizations, practicing their customs and traditions still, practicing religion still using their language, performing in certain arts or literature that is similar to them. So sometimes it really does hurt a person if they're going through a family issue, but we could provide them with the trauma-informed care that could still maybe relieve some of that they're missing at home and still within their same culture.
Yeah, absolutely. You know, one of my favorite styles of therapy is acceptance and commitment therapy, that I feel like you're speaking to it some, because sometimes you just have parents who are not going to give you what you need, parents that are not going to engage, and still you can do something about this. And he puts ownership on you, and I love that. Absolutely. And also I was in who said this? I went to a talk recently, and this woman, this was a Black woman who said, I am a firm believer that therapy doesn't have to be the answer. Is that I think that therapy is a privileged, almost like stance, right? Like not everybody can access it. It's not always available. And there are other things that you can do. And the things that you mentioned, Erika, is very similar to what she was saying. It's like community, religion, like there's other supports that you can get. And we could help these kids find it if therapy is not going to be the way. Like we still have the responsibility to help our people, but it's so true. I love your comment.
But I think it's also really important. It shows the person that we're really interested in them and their roots, not just the overlooking of their situation and then trying to give them some form of therapy. So really getting to know them, everything about them, and then after that is when we can also talk about the suicidal ideas with them, because we've now built a relationship with them and we really understand who that person is.
Exactly. Yeah, this is great. All right, so we have 5 minutes left. I want to make sure that we talk about the next slide. I really appreciate that you all participated in your feedback right now, your ideas. It's so good. I loved it that you were actively talking in your groups. Very, very good. Okay. So as a system, maybe some of you are in a position to influence hiring in an agency, or to change protocols. Like, I don't know where you, like what roles you have in your life, but like, it's important to hire Latinx staff. Yes, I want my peers, the white allies, to become culturally humble and affirming. Yes. And we also need Latinx staff, okay? We do need to embrace diversity and really incorporate all of these ways that we're talking about into our practice. I think that maybe this is wrong advice, but like I think for warmth and for connection, we just need to lead with the heart, like basically a bottom up approach, right? Because you get the person, and then you're like, oh, you know what? I learned this skill in my class, like how to like reframe thoughts, or like I'm going to do this mindfulness exercise, or I'm going to teach him to do tip for intense emotions. But that comes after. You connected with your heart. after you get where they're coming from, after they're there, after you've hooked them into therapy and they trust you and they know that you get with who they are more. You allow extra time. I don't know about you, but I'm often late. So you kind of like build it up into your thing. Not very late, but a little late. We need to have all materials in Spanish. I mean, I still go to places that don't. Why? I don't know. You know what? I do know. There's a lot of places in hospitals right now that they just want the check. Oh yeah, we care about diversity. Check. And in practice, it's not looking like that. So we need to start making the practice meet the words. Evening hours. I know it's hard, especially if you have kids. So this is where we start, like, I mean, when I was younger, I was doing that, right? Like it's developmental for some of us. Like when I was younger, I had evening hours because a lot of our Latino parents have multiple jobs. Some of them can't even come. You know, there's places where they are providing a way to log in through Zoom to families that can't afford transportation. They give them the modem, like they give them the ability and like a little, this is grant related, like we should be getting grants. I'm going to go on a tangent here because I have many ideas and I don't have the time. We also need to be collaborating with the physicians because they're more likely to go see someone for a medical problem than for a mental health issue, right? So like we need to be in there, in those offices. It's going to be like, hey, Fairle, this person just came in to see me for lower back pain. Like, could you just check in with them? Maybe that's how it starts. Like, hey, like I heard about this. We need to create a system that can help us have the access to them. We have 1 more minute. Any questions? We have 1 minute. Oh yeah, that's awesome. Specific grants made for specific Spanish speaking roles. Oh, you know what? I was reading the chat group. Socorro said that her supervisor said to not speak Spanish. Socorro, I think you continue to speak Spanish. Good for you. This is how the system tries to make us invisible. We can't. And we can't because we have younger generations coming in, hopefully into the field, and we need to model it for them and to create a path for them so that they can continue to thrive and not be pushed down. So I just wanted to go back to that.
I think we have made it to the end, unfortunately. I want to thank Dr. Fabret so much for being with us this morning. It was truly an amazing morning. I want to thank you all for your level of engagement and interaction and for everything that you shared, both during the main session and in your groups. This was the first time we had Dr. Fabret as a presenter, and it was just a great experience, I think, for us. We hope it was for you as well. We are going to be dropping a training evaluation in the chat. At the end of that evaluation is a certificate. So if you need that, do complete the evaluation. But as always at Caltrin, we read every last one of those evaluations and we base our scheduling on those evaluations, on what you're looking for and on your feedback. So take a few minutes and complete it. And we hope that you will join us again for training very soon. We have a lot of amazing training coming up. We are going to close this room in just a couple of minutes, but if you have your training evaluation open, it will not disappear if you leave. So don't panic. Take the time you need to complete it. And we will send that follow-up email out in the next 2 days with the recording, the vignette, the slides, and anything you might need. And we look forward to seeing you again very soon.
Gracias.
Thanks all.